Good evening to you. Professor Jen here, lecturecast number 2, week number 2. We're doing great, women in crime, and staying along with the syllabus. I have a couple things on the syllabus for you this evening, as you well know, that talk about sex's power, control, gender differences, women in prison, women in jail, and what happens to them when they become reentry. Those are a lot of topics. Tonight I want to focus my discussion primarily on something that you probably aren't aware of at all, and that is really the gender bias and the differences what women face going to prison and jail versus our male counterparts. Tonight's discussion at some point might be a little on the graphic side, but I wouldn't say horribly graphic, so this shouldn't be a problem for most people. A couple housekeeping issues. Our captioning personnel is doing a marvelous job, and the captioning will take 4 to 5 days from the time of the lecture cast going up, which will be, of course, Tuesday. And then our chats and questions and assignments for the week will be going up, of course, Thursday. And I see that we're really following suit exactly how I had hoped. Excuse me. For the purposes of our chat this week, we're now in week number 2, which is week chat 2. So good evening to you again. Very often people say to me, what is the difference between prison and jail? And I start off by talking about the legalities of it all. It's very hard for people to understand that you can really have a true murderer sitting in jail and somebody in for passing bad checks sitting in prison. Jail and the sentence of the term is decided by 365 days or less for sentencing, not the crime, the time of the sentencing. Jail is, again, 365 days or less, really regardless of the crime, in most cases. Prison is, of course, then what? Roughly 366 days and more to have state incarceration. What are some of the differences? I've been to both. I've been to prison and I've been to jail, both in the male side and the female side as an occupation. And I can tell you that there's some striking differences. To date of filming this lecturecast 2013, I'll speak to you on something that's extremely current, or courant as they say in French, and relevant. In prison, you can smoke cigarettes. In jail, you may not. Many inmates, whether they're male or female, enjoy having a sentence that's 366 days versus 365 days just for the purpose of smoking. In New York State, as far as women are concerned, the state system has a very interesting circumstance at Bedford Prison, which is located down by Westchester. Actually, it's located in Bedford, New York. It was one of the very first of its kind. Pardon me if I keep looking down, it's just that I'm looking at my notes. It was one of the very first of its kind here in New York State where women could enter the system pregnant. So in other words, they can have committed a crime, pregnant, been sentenced, pregnant, and sent to their penitentiary, pregnant. And what happened at Bedford is that depending on what it is that you were convicted of, obviously not crimes against children or the elderly or developmentally disabled and vulnerable populations, but if you were convicted for other things that were not considered terribly violent, you could actually maintain your pregnancy in prison, have the baby either in the prison hospital or, if necessary, a planned cesarean section, which is odd because nobody's ever given the time that they're on a call-out, which is how we say it, a call-out. So they have some sense of when they're going to have their C-section, but they're never really given a date terribly in advance because they don't want to take a chance of the inmate planning escape routes to their cesarean section. Now, I've been pregnant, and I can tell I've had a cesarean, and I can tell you most women, when they're at that point, in their pregnancy and big and uncomfortable, they're not planning their escape route. So it sort of seems pointless to me not to give the person their due date and when they're going to have surgery. It becomes strikingly evident usually around midnight before your C-section in prison, because very often a prison guard will tell you, do not drink any water or ingest any kind of food source and or smoke, because tomorrow morning you'll be having an event. Of course, they don't go and tell you that you're on a call out, but you can just imagine you're in a pre-surgical situation. After the mother has her C-section, if she leaves the prison facility to go to a hospital, she can opt to keep the baby for up to 2 years at Bedford Correctional Facility. This poses a lot of sociological questions, such as, is it wise to have an infant in their developmental stages into toddlerhood within a correctional facility confine? I want you to think about that. This would be a good time to perhaps get a pen and write this down. Is it wise to have a toddler really enter the prison system and be in the prison system until he or she is 24 months old? Is that wise? I would like you to look that up on the web, anything that you can find, provide the link in the chat room, and tell us your thoughts. But this happens at Bedford. Bedford has its own self-contained microcosm. It has a daycare center. The mothers are able to bunk with their children. They're able to breastfeed. That's certainly a benefit. They're able to have that maturational maternal bonding, which if you're any psychology majors out there, we know that so much emphasis today is put on what? Those very few hours of life and the ability to bond with the mother. And I don't want to dismiss the fathers. Fathers are equally important. But in our case, for our discussion, they're bonding solely with their mother, because when you're in state custody, usually the father of the baby cannot be with you because you're really what? Custody of the state. I would like you to look that up and come to a decision whether you think for our chat purposes if that's wise or not. At Bedford, another striking difference is that it's more of a homey atmosphere. Women can pick their bedding, providing that the content is not highly flammable. Women have many, many more choices on personal care products, such as different kinds of deodorant, the packaging of the deodorant, tampons, pads, etc. Things that women need, let's not be embarrassed, for their activities of daily life, as they have biological needs. In some jails, not many, but in some jails, there's a ban on even bras, because they're afraid that inmates, persons in custody, will use that as weapons to choke other inmates and or to hang themselves. It really depends on the amount of security risk that a jail feels that they can take. But at a prison, more of these, quote, amenities are available for women. So of course, even if you have a crime that you do 364 days in sentencing, it's best to bargain to get the 366 days to have those 2 extra days, but you have your, what I call, creature comforts. When you have a child and you go to jail, there is a striking difference. Most jails are not equipped for the mother to keep her baby. Here in Monroe County, the mother can keep her baby up to 2 months, providing she and the baby are in solitary confinement. I don't think that's healthy. When I worked at the jail, and I visited twice a week, I would make it my point to visit the women in solitary confinement who had just given birth. Very often, these are mothers who don't have the proper education, socialization, or patience to be locked up with a screaming, crying child for 24 hours, with the exception of 1 hour of recreation. Now, mind you, the guards are not there to provide daycare either. The purpose of the guards, or in our case deputies in the jail situation, is to provide overall security and safety to the general population. Therefore, all the caretaking of a child in jail for 2 months is relying upon the mother. That's very unhealthy. Not only unhealthy because she's in jail and because of the circumstances, you can ask any mother. In fact, another thing I would like you to do for chat, and this is a good place to get a pen, or put me on pause and replay me, is I would like you to ask somebody that you know is a mother. That can't be that hard. Most of you have a mother. Or you have a friend that has a mother. Or you can email me personally, and I'd be happy to tell you. It's very hard to be for 2 months with a newborn child, whether you've had a vaginal delivery or a cesarean, really on your own, almost 24 hours a day. The crying can get to you. Your need for rest is very, very important. I almost think that's a situation where it's a set up to fail situation. And I don't think that the 2 months maximum is adequate bonding for anybody. It almost seems cruel. Yet, on the other hand, it's necessary in some cases because very often a family member does not wish to come forward to take the baby, and very often a woman will enter a jail situation 7 and 8 months into her pregnancy and or delivery. Just because somebody's 7 or 8 months pregnant doesn't mean they're going to go to their 9th month. And there isn't enough time in the foster care system to find placement for this baby. Often the babies that come into jail are malnourished, vis-a-vis a poor gestational situation. The mothers were crack addicted or heroin exposed, or the babies come with a variety and multitude of developmental disabilities and organ disabilities that don't work that easily. And they're now what we call designer babies. I hate that term, but that's what people call them. So it almost becomes a catch-22 where even though the jail's not best equipped to handle these children and or their mothers, they have to because there's no place in which to put the children. Back in my day when I was born, and somewhere around 1970s it ended. I was born in 1963. I'm going to be 50 this year. They had something called foundling hospitals where people could just, for whatever reason, pre-adoption, jail, maybe unwed mothers, which was considered morally criminal, and in some states actually criminal. You get thrown out of school for being an unwed mother. They would put the babies in foundling hospitals. We don't have those anymore. So we're really relying on these other systems. But if you have nobody else to come forward for you, the jail then becomes the new birthing center. Is that appropriate? Not in all situations, no. Very often when a woman, in some cases a girl, comes into custody, it's a very striking difference than when a male goes into custody. When a male goes into custody, his family usually doesn't take a hike. A very interesting film I just saw this weekend, I'll spell it for you. M-A-N, like man, I-T-O, Manito, filmed in 2003. A story about men in a family setting that had been incarcerated. Not a documentary, a fictional piece, but it has so much supporting cultural context that this happens. I'm telling you it does. And the family doesn't take a hike when the male comes into a facility. Rather, they're very supportive. When a woman enters custody, whether it's jail or prison, whether she's pregnant, not pregnant, she's usually not visited and not well received by her family in custody, through incarceration, and then in post-incarceration and reentry. Women in our society are sort of written off from the moment they come into the gates because there is a double standard. Women are not supposed to serve, women are not supposed to commit various crimes. It's just unacceptable in our society. This idea of the naughty girl, the bad girl. It's frowned upon. In fact, Albion Correctional Facility, which is 45 minutes away from downtown Rochester, located in Albion, New York, which I worked for about a year teaching, many of the women would tell me something sort of funny. I had this inmate class person, student, and she had said to me how excited she was. She got a card from her mother for Christmas, and I said to her, "Well, that's super duper." And she pulled out the card, and all I noticed about this card is that it functioned as a postcard. I said, "Where's the rest of the card? All I see is the picture." She said, "Well, you know, Biggie J, my mother told me to go fuck myself, and she told me she hoped I went to hell, and how angry she was and everything else." She said, "So I ripped that part of the card off of the card, threw that part away because I didn't need to read it, but I was so happy to have a picture for my cell, even though my mother said terrible things about me, that I hung the picture up." As she told me this story, I could see tiny little mist of tears coming from her eyes, because women are written off. They're just too much trouble. When I worked in the male facility at Groveland Correctional, I would see the children come in on supervised visits, usually with a caseworker, social worker, service coordinator, family member, providing that the inmate wasn't in there for battery or sexual emotional abuse against a child or elderly or developmentally disabled person, better known as our vulnerable population. The children would come in, they'd sit with their dad, they'd sit on their lap, they'd play, there was a certain camaraderie, and it was just like a day out with dad. And in fact, many children had later told me throughout my experience that they liked it when their parent, especially their father, went to prison because they stood a chance in seeing him. When women went to prison on Mother's Day and other visiting days, the visiting rooms were empty, nearly empty, because the stigma was so uh, woven into the canvas of our society that women just don't go to prison or jail unless they're a real badass, that you barely ever saw a child there sitting on their mother's lap. And if you did see a child coming to the visiting room, the child was clearly very uncomfortable, and there wasn't that close bonding. Big difference. When a man comes into a correctional facility, there's a psychological makeup and workup that's done. There's a lot of invasive questions, medications, drug use, alcohol use, etc., that they need to know for assessment purposes. When a woman comes in, she very often has to discuss her menstrual cycle, problems with it, lapses in her menstrual cycle, birth control that she may have in her person, such as a Mirena IUD, or a depot shot, with often a male personnel at the jail, which can be extremely uncomfortable for many women. Even though they're criminals, that doesn't mean that they feel comfortable discussing very intimate parts of their sexuality and or their vaginal parts and or the workings of them, i.e. menstruation, with a complete and total stranger, very often a man, in the intake process. So we have a long way to go in corrections, in the sense that we have to supply and apply the right personnel for the right type of inmate. That doesn't always happen. In fact, when I worked at Albion and when I worked at the county jail, I noticed very often that women who were my age, 50, 40, 30, or real young ones, 18, 19, 20, would have to go to a male corrections officer and or deputy and ask for a pad or a tampon. I once overheard a corrections officer say to an inmate, "What exactly do you do with these tampons?" He said to her, but not to be cool. He just really didn't understand. He was young too, like 19 or 20. He said, "What exactly do you keep doing with these tampons that you keep asking me for one every 45 minutes to an hour?" At first I sort of looked over at him as a civilian and I thought to myself, why are you even asking her that? Then I realized he was young himself, that if you don't understand female anatomy and menstrual cycle and flow, this conversation isn't meant to embarrass anybody. We're talking realistically. You want to work in this field, this is what you're going to face. Well, some menstrual cycles for the first 1 or 2 days are very heavy, and you need to change your personal care items very frequently. But can you imagine being the woman that has to put herself in that position to ask a man constantly, "May I have another product? May I have another product?" Then, of course, we have the whole issue in many jails with the fact that the sanitary pads, which cannot be flushed down the toilet because of plumbing, have to be disposed of properly. Therefore, it's considered medical waste. Can you imagine having to be that woman to go to that corrections officer holding a soiled pad without any kind of covering and holding it and saying, what would you like me to do with this? It just doesn't seem appropriate. But sometimes what we think is appropriate or inappropriate doesn't catch up with the legal system and the residentials that we have provided by the state. On the other hand, would you like to be the male working at that job, dealing with medical waste all day and figuring out how many pads you need before you go on that shift? Now really think about this. How many pads you need before you go on that shift? How many tampons you might be asked for, etc., etc. So you're stocked appropriately to even be on your shift, so you don't have to have a security issue and breach security by going and trying to get more of these personal care items for the people that it is that you're supposed to be protecting from one another. The whole thing seems very peculiar, but I saw it for many years and it never made any sense to me. Sometimes males that I saw at the state correctional facility at Albion would come over to a bunk, that's where you sleep, and they'd say to a female, usually in her 20s or 30s, who had, the usual, heavy menstrual cramps, heavy periods, because why? That's when that usually occurs. And he would say to her, I see this myself, he would say to her, are you going to your work program today? Are you going to breakfast today? And she would lay there and say, I have horrible menstrual cramps, I can't get up. And very often, the males either didn't understand or they didn't want to understand. And there would be a whole discussion about whether it's significant that there are cramps, it's insignificant there are cramps, and it would become almost a heated dialogue that wound up pulling sergeants and lieutenants down to make assessments over menstrual cramps. Anybody that's ever had menstrual cramps can tell you they don't feel like getting out of bed. Same circumstance on the flip side, just to give you a comparison, when I worked at the male facility at Groveland Correctional Facility, there was a man who at the time was in his late 50s having some prostate issues. And he was having some problems with urination and some difficulty and some cramping. And I remember that there was a female guard on the dorm, or they say on the deck, like as if they're in the Navy, on the deck. And I remember she said to him, Mr. So-and-so, will you be going to work today? And he explained to her that he had some penis issues and some general discomfort in his bladder area and some pressure and burning and his prostrate this and blah, blah, blah. And she's sitting there looking at him as if he's speaking a foreign language. And it almost became really like a verbal fisticuffs because I don't think she believed him. Even if she did believe him, I don't think that certain genders are prepared to listen to other genders' biological and medical issues in all settings. So yes, there are distinct differences between men and women in prison and in jail. Another thing that's very important that I would like to close with in this lecture cast is the fact that when women come out of prison or jail, and you don't have to take my word for this, you can go on your own happy hunting, web surfing, there's very few places that take women post-incarceration, which bangs up the recidivism rate, because if you have nowhere to go when you get out, it's not going to take too long until you commit another crime to go back in. Whereas when men come back in reentry populations, there's usually many places for them to go because there isn't that stigma. At Albion, as I was saying before, that was once called the New York State Normal School for Women. That meant if you were behaviorally challenged, not necessarily a prison incarcerate or inmate. And usually it was a place for people to be sent that were, quote, troubled teens. And this was around the period of time of 1870, so we're going back quite a ways to roughly 1910. So this whole idea of women incarcerated is fairly new. And by the way, the numbers are growing. Women today are much more sophisticated criminals than I think even our culture expected them to be. Women find themselves not only being the victims of crime, the victims of criminology and gang life and muling and drug running. Women today have kept up with women's rights in criminology. Women today are running gangs. Women today are running drug muling operations. Women today, you don't have to take my word for it, look it up on the internet. Women today are becoming pimps. Women are running big businesses in sex trafficking. So as the doors to women's rights have opened for engineers, teachers, equal opportunities for attorneys, doctors, and the other professions, it's also opened its doors for women as criminals. Something to think about for sure. I'm going to leave you now in this lecture cast. I've given us enough to think about. I'll summarize. The difference between men and women and their biological issues and social implications. That's Meadow behind me coming to say hello. Hi, Meadow. How are you doing? Certainly, incarceration and children becomes a gender difference. Do you really want to be locked up in a jail or a prison? If it's a matter of 2 days, I would go the route of a prison because of the creature comforts. Post-incarceration and post-release, the differences for a man and a woman. And certainly the day-to-day issues that women face in prison of alienation and being alone because they've been stigmatized. Having said that, I'll see you Thursday night in chat, as I will be posting, of course, some new assignments for us to enjoy and some questions from the readings that I will ask you to answer. And then, of course, your question of the week, which is going to be collected by you and then prepared for me, and you'll let me have it in my week 11 Dropbox when the time comes, because it's going to act as our final exam. As always, I wish each of you well and to stay safe. And if there are any skateboarders out there, I guess really enjoy the weather because more snow is coming supposedly on Thursday. So live it up out there and so on and so forth. So as always, it's been a pleasure, and thank you for letting me come into your lives in this virtual world. And good night to you.